students, and this is Srindu, Master Professor from Department of Pharmacology. From today, we are going to discuss about the topic of job specifications for hospital pharmacists. Okay, first of all, hospital pharmacist means hospital pharmacists are one of the were engaged in it's one of the public sectors. Okay, it is a hospital pharmacy where it works on the hospital pharmacy and serve to the public sectors. Okay, it is called as a hospital pharmacist. Okay, from the what are the job specifications for available for the hospital pharmacist? Okay, from the section of from today, hospital pharmacists are employed by the both. Okay, hospital pharmacists are employed by the both MOH. Okay, from the sections MOH means the Ministry of Health. Okay, Ministry of Health and the private sectors. Okay, from based on the study of from the students learn B.Pharm courses. Okay, B.Pharm courses. Okay, and after the completion of the courses means they can work related on the Ministry of Health departments. Okay, or otherwise the private sectors. Okay, both they can work it work on. Okay, mostly they can work it. Okay, next they are responsible for. Okay, next from the study of job pharmacist. They are responsible for the checks. Okay, they are responsible for the checks, dispensing drugs. Okay, and performing quality monitoring dosage norms and monitoring drugs. Okay, monitoring drugs and reporting drug safety, storing medications in the hospitals. Okay, from the what are the if the students can play the role in the hospital pharmacy means what are the section means the dispensing main what are the main role means first one is dispensing drugs. Okay, the dispensing drugs. Okay, quality checking. Okay, drug monitoring. Okay, next drug monitoring, storing medications. Okay, and drug for example, if the patient get admitted in the hospital means what are the how the patient can be admitted. Okay, what are the treatments are available. Okay, what are the medicines can given by themselves, given by our sides. Okay, given by our sides. Okay, these are the job specification roles. Okay, next one is second question. Hence the pharmacist, hospital pharmacist performs the following duties. Okay, what are the following task duties? Okay, from if the patient, for example, if the hospital pharmacist can work it in the hospital means what are the tasks? Okay, what are the following tasks work on the public sectors. Okay, to serve to the patient care. Okay, to the patient care means first one is constantly supervising pharmacy. Okay, constantly supervising pharmacy and the related services and the logistics. Okay, constantly supervising pharmacy. Okay, for example, what are the medicines are available in them? Okay, what are the medicines are available in them? How many medicines are moved from our side to patient side? Okay, these are the analysis. Okay, simply the analysis. Okay, the analysis of the patient is the main role. Okay, or otherwise the analysis of medicines. Okay, the analysis of medicine is also one of the main role for the hospital pharmacy. Okay, and the statistics and the logistics. Okay, next one is preparing each drugs and adapting dosage form to the specific setups. Okay, preparing each drugs and adapting dosage forms. Okay, preparing each drugs. Okay, otherwise the patient can, for example, if the patient can admitted the hospital means what are the drugs are given to our side means the patient can analyze, and if we can analyze and give it to the patients. Okay, or otherwise how the medicines, okay, what type of the medicines can given to them. Okay, these are all the main roles. Okay, next assuring the effectiveness and the safety effectiveness of the drugs. Okay, assuring the safety. Okay, if for the main role. Okay, for the main role of the our side means for the main role of the hospital means first one is safety. Okay, patient safety and hospital pharmacist safety and the drug safety. Okay, these are all the main important things. Okay, that is the effectiveness of the safety of the drugs. Okay, next one is attending pharmacy manager clinics. Okay, otherwise clinical rounds led by the healthcare providers. Okay, attending pharmacy manager clinics. Okay, if the patient get admitted clinic means admitted to clinic means the healthcare providing some medicines. Okay, this is the healthcare providing medicines means the pharmacist can first analyze. Okay, the pharmacist first can analyze and then give it to the drug to the patients. Okay, this is the that point they can mention into them. Okay, next is providing sufficient data on drug consumption. Okay, providing sufficient data. Okay, providing sufficient data on drug consumption. Okay, for example, For example, the patient can take, for example, the patient can take in daily means histories. Okay, the histories the patient can analyze the histories. The pharmacist can analyze the data from our hospital sites. Okay, this is the main point. Okay, providing sufficient data. Okay, sufficient data is historical data, age, okay, like this age, sex, okay, address, phone numbers. Okay, these are all the sufficient data. And what are the medicines are the patient can take in advance. Okay, these are all the data were collected by ourselves. Okay, next offering pharmacy related training to the DPharms. Okay, relating for example the hospital pharmacy. For example, the hospital pharmacy, the hospital pharmacist can also related to working on or in some of the training programs or otherwise internship program to the or college students or otherwise working staffs to the themselves. Okay, for example, DPharm undergraduates, postgraduate students are also used to them. Okay, for example, if the person can, if the students can study in our college means the person can also interact with the hospital side. Okay, and it's called as an internship programs from the hospital side. Okay, it's like a DPharm postgraduates and undergraduate students are all eligible to attend the internship programs. Okay, next managing research activity related to the pharmacy. Okay, managing research related activity to the pharmacy. Okay, for example, the research activity side also the hospital pharmacist can involve and to knowledge about some historical data on the side of the pharmacy. Okay. That's all about the study of job presentation for the hospital pharmacist. Okay. Thank you.